Hi,
Hi, can you see me?
I can see you. Can you see me?
I can. Good. Perry, you can go ahead and cut the share screen for now.
Hi, Golzar.
Hi, how are you?
Good. How are you?
Good. So we're waiting for some people to trickle in, but I guess we'll start right now. Thank you everyone for joining us for part 2 of our free webinar series, Compliments of Downtown Women OBGYN. We at Downtown Women are committed to your maternal well-being, not just how you're doing physically, but how you are coping emotionally, especially during such a challenging time. My name is Golzar Selby Nakshanet. I am a licensed psychoanalyst and the director of the prenatal and postpartum support program at Downtown Women. With me again today is Dr. Suzanne Lajoie, senior obstetrician at Downtown Women. She will be answering your medical questions related to COVID-19 and the perinatal period. Say hi, Dr. Lajoie. For those of you who watched 2 weeks ago, you saw what an empathetic and loving doctor she is. I've always known that, and I've always known how much she values our patients. But even I, Dr. Lajoie, last week was in such awe of your expression of compassion. So it's really nice to have you again. What's that?
No pressure.
Lots of pressure. So before we start, I want to introduce the prenatal and postpartum support program. We're here for you throughout the course of your pregnancy and your first year postpartum. So whether you're feeling anxious, overwhelmed, or you're not sure how you're feeling, you can always reach out to us. We're here for you to support you in a variety of ways. During this pandemic, I am offering virtual therapy sessions over Zoom, both individual sessions and support groups. These are all subsidized by Downtown Women and are affordable. You can also contact me for referrals. I know plenty of practitioners who are accommodating patients over Zoom right now, and a lot of them are working on a sliding scale during this difficult time. So, money should not be an issue to get help right now. I am so proud to be a part of Downtown Women, an organization that is this dedicated to our patients and to our unique and comprehensive approach to OB care, which includes your physical, mental, and emotional well-being. For those of you who haven't yet spoken to Perry, Perry, say hi.
Hi, everyone. Thank you for joining us.
You should reach out to her. She will call you sometime during your pregnancy or postpartum period to check on you. She's wonderful and super easy to talk to. She does a great job at supporting you all and is an amazing resource, so you absolutely should use her. Last note before we begin, we created a feedback form to help us better understand how to serve you in this time. I know I said this last time, but there was a little bit of a malfunction and we couldn't get it out to you until a few days later. We're gonna post it in the Q&A section. It will also be in a follow-up email that arrives tomorrow, and I have put it in the chat. I think you should be able to open up the chat and see the link to everybody. So please fill it out. It's really important for us to get this kind of feedback so we know what is working and what isn't working, and we can really help take care of you at this time. Perry's email is also on your screen, pthompson@downtownwomen.com. If you have any questions, comments, or suggestions, please email them to me or Perry, and we'd be happy to assist you.
And Golzar, I just want to say, if we get really, really good feedback, we're going to start doing more webinars on, we were talking about like GYN stuff, menopause, endometriosis. So if we get good feedback, I think that would kind of prompt us to do more webinars like this.
Right, and maybe even introduce other practitioners and find other ways to help everybody feel really a part of the Downtown Women community and get as much dialogue between the patients and the providers as possible, right?
That's
okay,
right.
So should we begin?
Let's do it.
Okay, I am recording this time, everyone. I did not forget to press record. And then I have disabled chats because for any of you who were with us 2 weeks ago, we saw how distracting they were to Dr. Lajoie. But after we get through the questions that everybody has emailed, we are going to do a live Q&A. So as you can all see at the bottom of your Zoom is a Q&A section. I will also put the link in the Q&A section to the feedback form. Actually, Perry, can you do that now? So somebody said the chat is disabled. If you can answer that live, if you can answer the type answer, that would be great. Okay, so we're gonna start with office visits and prenatal care.
Okay.
So can you begin by going over the current prenatal and office telemedicine schedule, please?
Yes. So let's look at the whole schedule. So the first appointment is usually at about 10 weeks, somewhere between 10 to 12 weeks. At that point, we like to do a nuchal translucency scan. We usually do that at about 12 weeks. We also do testing for a non-invasive prenatal test or an NIPT. So that's the time where we kind of capture those two tests that need to be done. At 20 weeks, we do an anatomy scan. It says in office, it's actually done at NYU, which is not at the actual physical Tisch hospital, but is done at an ambulatory care center that is around 34th and Park. After the anatomy scan, we do a 24-week televisit. And let's just stop here and talk about getting a blood pressure cuff. Right? Let's just jump in and say, you know, everyone should buy a blood pressure cuff. You don't have to spend a lot of money on it. But when we do televisits, we are going to ask you about your weight and your blood pressure. So if you don't have a scale, you should probably get one at this point as well. The next time we see you for an
the blood pressure cuff and the scale, that's it?
That's it.
Okay.
Okay. At 28 weeks, I'm just going to turn you up a little bit, Gulzar. At 28 weeks, it's an in-office visit where we test for gestational diabetes. We test for anemia, which is a low red blood cell count. We also, if you're Rh negative, give you a RhoGAM shot. And at that point, we're also doing a Tdap shot, which is the shot for the whooping cough. Next in-office visit after that is at 32 weeks. And that's when we want to check the position of the baby to make sure the baby's head is down or in the vertex position. And if it's not, then that leads to further discussion. And then starting at 36 weeks, everyone is seen weekly until they give birth. And then the last is a 6-week postpartum telephone visit. At least at this point, we're doing telemedicine visits where we go over your history, how you're healing, and usually there's a talk about contraception as well.
Great. Could you offer an explanation of why I need to physically come in to certain appointments? As of now, I'm scheduled to meet in person at my 32-week appointment, and I'm not sure why that can't be a virtual session. So maybe just go in a little more detail because people ask a lot.
I think we're doing the televisit sessions as we feel are safe. We're trying to minimize you guys coming to the office as little as possible. Which is why we're kind of counting that anatomy scan at NYU as a check of the baby instead of having you come to the office at that point. But the 28-week visit is really important because of the gestational diabetes screening. That and the anemia screening has to be done. There was a question last week or 2 weeks ago about patients like getting their own RhoGAM shot and administering it to themselves. And this is to avoid all of that. We can do your RhoGAM shot. That isn't something you have to worry about. And then the 32-week visit is a heads up for us. If your baby is not in the head down position, then we need to start making a plan in terms of, you know, how we're going to deliver you.
Great, thank you. And for the partners, when and how should we get the Tdap shot?
So partners can actually get the Tdap shot in the hospital. I thought at one point they were offering them at like Rite Aid and CVS and Walgreens, but if that's not possible, do not worry, you can get it at NYU after your partner gives birth.
Thank you. Will Downtown Women call me to schedule office and telephone visits based on the new schedule, or do I need to monitor that?
Yeah, so nothing has changed. You still have to call Downtown Women and speak to the appointment secretaries, and they will hook that up for you.
Are partners allowed at the 20-week anatomy scan?
As far as I know, unfortunately, they are not. But they'll take plenty of pictures for you to share. We're really trying to limit partners in any medical facility at this point.
I have heard from some patients that if you ask really nicely that maybe they can accommodate a little more. So
I have not heard that.
Now, that doesn't mean your partner can be there, and that doesn't mean that you can take pictures with your iPhone, but that they might give you more pictures or something else. So
yeah. We've got a really strict policy in our office And I really appreciate that, you guys. I know it's so hard for partners. If any of you guys are watching, it's so hard not to come into our office. And I really appreciate your patience and just working with us so that we can limit everyone's exposure. I've seen some partners actually sitting on, little stools outside of our office. And I just really, really appreciate that, guys. And I understand how difficult it is.
Am I justified in worrying about changes in care such as lack of urine protein tests and the virtual 6-week postpartum?
No, I don't think you have to worry about that. Sorry, Gulzar?
The fact that the postpartum visit is virtual rather than in person.
Yeah, I mean, I think we can extract a lot of, there goes my ice machine, I'm sorry. A lot of, on point. We can extract a lot of good information. I think, part of the televisit, you should be reassured that a lot of this is extracting kind of information from you to see if you're healthy, if the baby's healthy, and postpartum, to see how you're feeling, to see how you're healing. And if there's anything that's a red flag during a televisit or during a postpartum telephone visit, then we would absolutely have you come into the office. So you should not worry about something being missed or that you're not getting the same kind of quality or amount of care, because you are.
So if there's any kind of concern, then you do ask them after that televisit to come into the office so that it can be discussed. Okay. Are Downtown Women childbirth education classes taking place online?
Yeah, so we talked about this yesterday. As of right now, they are not, unfortunately. We have put up, maybe Perry put up a list of virtual childbirth classes, but we're gonna have it up and running. I promised a date of May 1st. So Ann Ramos, who's our childbirth educator, we have to get this chat, Zoom, Skype, whatever it is, going, which is a challenge of mine. So I'm gonna step out of it and let Gulzar handle it. But by May 1st, guys, we'll have it up.
If there's a deadline, I will meet it. So it will be done by May 1st. So yes, they're not happening yet, but we will have them after May 1st.
Okay.
So now let's move on to delivery and Langone.
Got it.
Remind us of the address that we should use to enter labor and delivery.
So it's 555 61st Avenue. It's a big entrance with, you can actually drive up in a car with revolving doors. You should definitely use that entrance and not the entrance to the Kimmel Pavilion, which is on 34th Street and the FDR Drive. So you should not use that entrance. Use the one at 555 61st Avenue.
Perry, can you please share the screen with the address? Thank you. And Dr. Lashwa, can you tell them why one address is better than the other?
The Kimmel Pavilion tends to be a little more, not chaotic, but busy. I think that's the right word. There's a lot of ambulance activity and people coming in and out, and there are more COVID family members that are hanging out there. I feel like the 550, 560 entrance is calmer. And I think you'll feel much more kind of at ease using that entrance.
And where can we self-park at NYU?
Well, Perry has put up a nice little slide here showing the garages.
He's the best.
So, yeah, the best. So there's one, actually, if you're going up First Avenue on the right side of the street, there's one right adjacent to the hospital, and then one directly across from the entrance to Tisch Hospital.
Great, so all of the addresses are right there on your screen. I would just take a picture of that so you have it for later. What doctor or line do we call when we go into labor?
So you call call the office. If it's during the day, call the office. You can press the emergency line and one of our nurses will pick up for you. If it's at night or on the weekend and the office is closed, you can still call the office and you'll get a recording. And it will say, if you're an obstetrical patient and this is an emergency, call this number. So that's the number you should call. All the patients get at their first sonogram an actual gray folder, and in that folder is a card. And on the back of that card is the direct service number. So either use that number, which is the same number that you would call in the middle of the night, that the office number will prompt you to use.
Are the Downtown Women patients separate from other labor and delivery patients? at NYU?
No. All the laboring patients are on the same unit. There is not a special section for Downtown Women patients.
What is the current screening process for COVID at NYU? Will women giving birth and their partners get swab tests for COVID when they enter and leave the hospital?
Okay. So when you come into the hospital and you use that entrance, or if you use any entrance, there's going to be an employee entrance and a visitor's entrance. So your partner and yourself will go through the visitor entrance. Your partner will be screened for symptoms, meaning they'll be asked if they have fever, cough, body aches. If that answer is no, then you guys will be allowed to come into the hospital. If as a patient and you're in labor and you have cough, fever, or any symptoms of COVID, then obviously you will be allowed in and you will be swabbed. Does that answer that question, Gulzar? I think it does.
I think so.
People who are asymptomatic are not getting screened, which I think is the message that I want everyone to get. If you come in and you're feeling fine, you're not automatically getting screened.
And what if my partner has allergies and I don't want his symptoms to be mistaken for illness?
I would say this is a good place to use an allergy pill or something to, if it is allergy symptoms, to kind of like hold them at bay for a little bit. And I have to be honest with you, if a partner comes in and looks sick, they're not going to be able to enter the hospital. So I would encourage everyone to have maybe a backup person in case your partner or your primary person gets sick, just so that you have a backup.
And I think this is really important to remember that if that happens to be your partner, that is very disappointing. But if it happens to be somebody else's partner, we're doing this to protect everyone. And so, yes, it's disappointing, but it's also very necessary at this time to keep everybody safe and all the babies safe. So just to be clear, to go over it, only if you're having symptoms will you be screened.
That's right.
And tested. Any partner who shows up with any symptoms whatsoever will not be allowed to join.
That's right, Gulzar.
But you can have a second person who stands in for your partner.
Right. It's one person, and that person can't come and go. But if instead of your partner, it's your sister, then that's fine. She can come in, but she won't be able to leave and come back in. You won't be able to swap her out for your partner.
You know if there's an age limit on that? Like if somebody wanted their mom to come in instead?
I haven't seen an age limit. I think this is kind of my personal feeling that if someone is 65 or older and you can avoid them being in the hospital, that's probably a prudent move. And I don't think there's a lower age limit.
Great. Can you elaborate on how labor and delivery unit of Langone is separate from COVID areas for patients, doctors, anesthesiologists, everyone?
Okay, so we have our own separate unit, which is on the 8th floor of the hospital. We take up the whole 8th floor of the hospital. The patients who have COVID and are being treated for COVID are actually in a different hospital in the Kimmel Pavilion. We have a dedicated set of nurses. So the labor and delivery nurses are special. They're specially trained and they don't go to COVID floors. They're not working in the ICU or the ER. They're dedicated to us. We also have our own team of anesthesiologists who do obstetrical anesthesia. So they're with us all the time and it's the same group of doctors. They're not going to COVID areas. They're not going to ICU areas. And we even have our own building service who keep the rooms and everything clean. So they're also dedicated to labor and delivery and not working on any other units.
Great. What measures are being taken by labor and delivery at NYU to prevent the spread of COVID?
So you'll see when you get there, there's a lot of PPE being used. Everyone's wearing gowns, everyone's wearing gloves, everyone's wearing N95 masks. And we're wearing face shields now, which is what you see on TV with that kind of like headband that covers the face. So we're doing all of that at this point. Everyone's wearing that when they're dealing with patients.
Will the janitors and other non-medical workers working in the COVID sections of the hospital also be working in the labor and delivery unit? So is anybody going to be crossing over from one to the other?
He's going to be crossing over and everyone you see will be wearing a mask, even the housekeeping staff.
What type of mask do you suggest for hospital visits?
I think any mask is fine. If you have a surgical mask, that's great. I don't think you need an N95 mask. And if you don't have a surgical mask, then you can just use a bandana or a cloth covering is fine. And I just want to plug, if you have a mask and you're in labor, come in with your masks. We really appreciate that as healthcare workers, if you're kind of trying to protect us as well. So feel free to bring a mask into the hospital when you arrive.
And that's the same mask the same applies for the in-office appointments. Whatever mask they have or a bandana can be fine.
Right, and if you come in with a partner, your partner should also have a mask if possible, or some kind of cloth covering.
What is the situation for the post-delivery rooms? How should we act if rooms are shared to avoid COVID exposure?
Yeah, so first of all, you'll be paired with someone who also is asymptomatic and someone who we think does not have any COVID symptoms. So that's the first point I want to make. Then there becomes the question of, should you bring your partner, right? And if we're trying to decrease COVID exposure, then I guess the answer is to limit anyone who's in the room, right? But however, at this point, we are saying that patients can bring their partners. It's a tight fit, it's a small room. So it would be 2 patients, 2 partners, and partner has kind of like a fold out chair or a fold out little small bed, and then 2 newborns. So just heads up, it's a little bit of a tight squeeze in those rooms, but you'll be with someone who is asymptomatic like you. You won't be placed in a room with someone who has any symptoms or there's any suspicion for COVID disease.
So just to be clear here, the partner shows up and they labor together, deliver together, and then they go into the postpartum room. Would it be better if the partner didn't have to stay there for the 24 to 48 hours and went home?
Yeah, I mean, I think in terms of spreading COVID, and we're assuming that everyone could be positive and that there is asymptomatic spread, you know, I think not exposing 2 patients and 2 newborns to potential exposure from 2 partners makes sense to me. However, I really feel like we would never take that away from a patient. If you feel like you need your partner with you, absolutely, it's fine, they can stay. But also realize you're going to get really good nursing care at NYU. The postpartum nurses are amazing. They take really good care of our patients. You're going to get great breastfeeding support. So everything you need in terms of support in the hospital will be there for you.
Are private rooms available?
Private rooms are available. Private rooms are, COVID patients are getting first priority of private rooms, obviously. But yes, there are private rooms available.
And a lot of patients have fled New York, right? A lot of women are leaving New York. And so does that mean that there's maybe going to be less crowding and more private, potentially more private rooms available?
Maybe goes up. So there has been a dip. We obviously spoke about this earlier. There has been a little bit of a dip in the number of deliveries at the hospital because people have left New York City. So there's less crowding on the labor and delivery unit, less crowding on the postpartum floors, and probably less people that have to be in a shared room. So if anything, this might be, you know, if you're delivering at NYU, this, you know, could be a time where when you will get a private room where will be less crowding.
Wonderful. So talking a little more in depth about the partner, is my partner allowed at the facility throughout and after birth? Is there any period of time where they're not?
They are allowed there the whole time. They're not, you know, made to leave at all. They can be there the whole time.
And so what's the current policy on leaving? If partners are not allowed to leave, what are the most important things to make sure we bring to the hospital?
Yeah, so I think the point I want to make is you don't need a lot of stuff. I see people coming in with like suitcases and birthing balls and all this other stuff. You really don't need that stuff. You should bring a car seat. I always say, you know, if you're going to have, I love Perry. Now I can just read this, Perry. This is amazing. So an outfit for the baby, right? I mean, your baby will have an outfit, a very cute outfit while the baby's in the hospital, but if you want a special thing to bring the baby home with, you should absolutely bring that. You're gonna be nursing, so you should bring your nursing pillow. which can be kind of bulky, so that you would probably won't fit in a suitcase. But you should bring whatever you're going to breastfeed in. So if you have breastfeeding tank tops or nursing bras or, you know, whatever it is, you can feel free to bring your own nightgowns, whatever toiletries you want to use. I usually recommend that people also bring an eye mask and earplugs. People don't really think about that, but those two things can be actually helpful, especially if you have a roommate.
I saw somebody raise their hand. I'm going to be honest with you guys. I do not know how to deal with the raised hand feature yet on this thing, but we will be doing Q&A after this is done. So whatever questions you have, you can just pop right into the Q&A because we will go over everybody's questions as much as possible after we get through. Apparently, it says somebody raised their hand. I don't know what that means. It's just like waving back at it. Okay, so to be clear, your item should be able to fit in a duffel bag, not a suitcase. That the rooms are already small and there's already a bit of crowding. So really minimize what you're bringing to the essentials.
And the hospital has protein balls. We have tons of peanuts. We have enough for everybody. So those kind of bulky items, please leave them at home.
Great. There are also rumors that birth partners now need to leave some hospitals 2 hours after birth. Can you address if NYU is doing this?
NYU is not doing this, and they never have done that.
What if I have a C-section? Will my partner still be allowed to stay?
Yes, your partner will still be allowed to stay. Let's just stop on C-sections for a minute because there is a brief time when the mom and the partner are separated. So when we're gonna do a C-section and we go to the OR, we actually have the partner just wait outside the door just briefly as we set up a sterile environment and we kind of set up the OR so that you know, we're doing it in a safe way. And then right before we start the procedure, the partner's actually right outside the door and is welcomed in to be with the patient.
Now that is how it's always occurred. That's not COVID specific. That's just the routine.
That's the routine. That's always been the routine. COVID hasn't changed that. Labor and delivery is very, very, very much the same and not much has changed there at all. The only thing that's really changed is that we're wearing more PPE.
Great. Does my partner need to arrive at the hospital with me? Can he drop me off, then park the car and meet up with me later? He or she, I should say.
He or she, or they, we should say too, right, Gulzar?
Yes, she, they.
Yes, absolutely. They can drop you and then come back in. That's perfectly fine.
Will the cafeteria be open and available for my partner to access food during the stay? And will they be allowed to use services?
Will they be allowed to what?
Answer the first one. So the cafeteria is open and it is available to partners.
It's open late for coffee, I think up until 11. That's when I usually get there. But yes, it's open and the food is great. They have pizza, they have bagels, they have salads, they have, you know, entrees. It's a great cafeteria.
Who's eating salads right now? This is the time to stress eat pizza.
They have that.
Okay, and then will the partners be allowed to use food delivery services? So I think this question, they mean like seamless?
Yeah, so if you want to use seamless, it's kind of the same as we do in that no one's allowed up to the floor. So the person has to, all of the delivery guys are coming to the lobby and then you would have to go downstairs and meet them there and bring the food up. So that's still in place.
Can the partner do that? Go down to the lobby and get food and come up without leaving the hospital?
Well, they're not leaving the hospital. They're just running down to the lobby. Okay. And that's okay.
Where is NYU keeping delivering women who have tested positive?
So women who are in labor and who test positive are laboring in labor and delivery. There's nowhere else for them to be. That's the place for them to be. They're obviously in private rooms and not roaming the space, and they're being isolated and kept separate from everyone else.
And are the nurses the same who will treat COVID and non-COVID moms? I think this is a really important question.
Yeah, so I actually gave the labor and delivery unit a call yesterday as we were figuring this out. But yes, all the nurses can take COVID patients. If you are COVID positive and you're in labor, you will have a dedicated nurse. So that nurse will be only with you and not seeing other non-COVID patients. So yes, all of the nurses can take care of COVID patients, but that doesn't mean that when they come back or they're doing another shift, they will take care of a non-COVID patient. They know all the necessary precautions to take in terms of caring for that person in a safe manner and taking care of all of our patients actually in a safe manner.
Okay, so if mom A has COVID and mom B does not have COVID, there is a nurse who is only treating mom A and staying with her the whole time and never goes to mom B.
That is absolutely correct.
Thank you. Please explain NYU's current policies on what happens if I test positive before delivery.
If you test positive before delivery, that would be the same situation. I don't know if the person asking this question means like they had COVID and they're recovered, or if they have active COVID and they come to the hospital.
Well, let's focus on active COVID because we want to talk about the breastfeeding and what's happening postpartum, the partner's role. Let's go into all of that, and then I will bring up a quote that I think is really important here.
Okay, I wonder what quote that is. So, you know, I can't help what those are. It's just.
We clearly pre-planned this. Go ahead.
So if you're COVID positive, then just exactly what we said is going to happen. You're going to be in labor and delivery. You're going to have your own labor and delivery nurse. Nothing is different. You're going to give birth, and you'll have that nurse with you. Did you want to ask a question, Gulzar?
Yeah, well, let's focus first on feeding the baby. So let's say postpartum. We're now postpartum. What's happening?
Positive patients, and you've had your baby. So we are separating the mom and the baby at that point. Okay. We're still really big on breastfeeding, and we would still like the baby to have breast milk. So your nurses and the lactation consultant and everyone who is around you will help you with hand expression and help you with a breast pump in the hospital. You do not have to bring a breast pump, guys. We have them. And the baby will be fed your breast milk.
And what if the partner did not test positive?
So then the baby can stay with the partner. You know, the baby will be in the nursery, not in the mother's room, but there's no reason why the partner and the baby can't, you know, be together and hang out together and be held and all that stuff. And
when the mom is discharged, the mom and the baby, are they discharged together or separately?
They're discharged together, yes. They'll be discharged together with the hope, I think, that the partner who's asymptomatic will mostly be with the baby and trying to continue that isolation, but absolutely they will be discharged together.
And so all three can be discharged together.
Well, the partner is in the patient, but the mom and the baby will be discharged together with the partner.
Okay, great. Now I'm going to read a quote from an article. Like a growing number of hospitals, NYU has prided itself on its World Health Organization and UNICEF-granted baby-friendly label, which relies on physical closeness with the birthing parent and the importance of breastfeeding. Not coincidentally, the World Health Organization says that the harm from separation outweighs the risk of COVID-19 and recommends direct breastfeeding with a mask. Initially, we thought there was no evidence of babies getting really sick, Keefe said. Then last week, 2 American babies who tested positive died, a 6-week-old in Connecticut and an infant under a year-old in Chicago, although medical examiners haven't yet made full determinations. Keefe said bluntly, on one hand, we're trying to keep babies and mothers together. On the other hand, we're trying to keep babies from dying. Now, just to be clear, Dr. David Keefe is the chairman of obstetrics and gynecology at NYU. So this is why this is very relevant. The quote continues, globally, there is no consensus on this front. China separated all mothers and babies, while Britain's Royal College of OBGYN opposes separation. Back to a quote by Keefe, that's because nobody knows. Doctors are human, he added. They're also terrified of getting sick themselves or having a dead baby on their conscience. The World Health Organization policymaker walks away and says, oh, I guess I was wrong, but the doctor doesn't sleep for months.
Yeah, so I think this really speaks to what a struggle it really is, and that there really is no correct answer. NYU is really, when we got that baby friendly, like not nomination, but we got that baby friendly, whatever it is. Yeah, we got it. I was a part of that. It was a lot of work to get it. And, you know, we've always kind of, there's no formula on the unit, you know, it's all breastfeeding. We get the baby right on the breast. Like that's such a huge thing for us. But at the end of the day, it's about keeping a baby safe and keeping our mothers healthy, obviously, right? We want, everyone's gonna come out of this with a healthy mom and a healthy baby. And it's a struggle because the truth of the matter is that we don't know, you know? So there have been 2 infant deaths. You know, what do you take with that information? Because originally they were like, no one can get COVID, no babies, no children really get COVID. This is a disease of adults. So what do we do with this information that we now have 2 babies that have died from COVID? So, you know, I don't know that those 2 instances have made this decision, but I get it. Like as a physician, you know, we are human and we don't want to separate mother and baby. But when we have a sick infant or a sick mother, you know, on our hands, it's devastating to us. So I think, and I say this in labor and delivery all the time, like safety first, warm and fuzzy second. Like the priority is that everyone needs to stay safe. The baby will still get your breast milk. This is something that may change. And hopefully, you know, the discharges are actually, you know, happening a little bit sooner and sooner. So the separation will not be that long.
I think it's really important to note that these decisions are made out of concern for the well-being of the baby and the mother, and that it is a very hard decision. I think it's really important what he said, that the World Health Organization policymaker doesn't actually have to deal with what's happening in the hospitals, and you guys are.
Yeah, no, that's a good point, Gulzar. You know, we're not policymakers, we're doctors, we're in the front lines. We're the ones who, you know, have to deal with the outcomes on the mothers and the babies. And, you know, to go by a blanket statement that perhaps is not true, you know, kind of makes us rethink, you know, what is really safe in this situation.
Are we ready to move on to the next question?
I am.
What would happen if the delivering doctors at Downtown Women got sick?
Well, hopefully we won't all get sick, right, Gulzar? So, we've been doing some things to keep us healthier. We've decreased the amount of time that we're on call. So instead of being on call for 24 hours, now we're doing 12-hour shifts so that we're spending less time in the hospital. So that's one thing that we're doing. We also have a private on-call room now. There used to be a call room where there were 4 rooms and everyone was kind of on top of each other. So we actually have secured a private call room for us, which is great. So that decreases our risk right there. And then the other thing is what we're doing in the office. So in the office, half of us are working from home and half of us are in the office. So, and then we flip flop. So this way we're trying to always keep half of our staff kind of, you know, at home if there is an exposure in the office. So one of us will be delivering your babies, guys. Don't worry, one of us will be there.
I think it's really important to note that Downtown Women has been really proactive in making sure that the doctors are not getting sick and that there can always be somebody available to our patients.
And also the policy of not having the partners come in is another way that we're trying to keep ourselves healthy, quite honestly.
Which means you guys get to have the doctors who you know and trust, which are the Downtown Women doctors that you chose.
Uh-huh.
So is an ambulance safe to take to the hospital if you are delivering?
Yeah, so is it safe yet? Should you call an ambulance?
Very confusing. The answer is no.
So I would really save an ambulance for a dire emergency. Ambulance, they're really, really busy these days, you know, especially just being at the, you know, certain entrances of NYU. There's a lot of ambulance activity happening there. So please don't call an ambulance if you're in labor. Take a car, take an Uber, have a friend drive you. Please don't call an ambulance. That being said, if you're having a dire emergency and you need an ambulance to take you, save those calls for those instances.
Great. And there's also probably some delay on ambulances right now.
Of course, yeah.
Necessarily faster.
Right.
And we're in a time of no traffic, so
that's true.
car will get you there quickly.
Yes, it takes me 15 minutes to get to the hospital from Brooklyn now. It's amazing.
Wow. People speed on my street all the time, and the cops are never stopping them. So,
Anybody.
what protective equipment will patients be required to wear during labor? So I know we said come into the hospital with masks. Is that staying on during labor?
Yeah, I mean, we'd like to keep it on as long as possible because that limits, it helps for us not to be exposed. You know, that being said, if you're pushing, I don't, you know, we're not going to force you to wear your mask, just my face, while you're pushing. Just keep it on as long as possible, and we would expect your partner to keep it on the whole time.
I understood interventions will be happening more frequently and earlier on, and I would like more information about timing and potential scenarios during birth.
Yeah, so that's a rumor. I don't know where that came from. Nothing has changed in labor and delivery. COVID has not affected obstetrical decisions in terms of when to intervene. COVID is not a reason to induce labor. It's not a reason to have a C-section. It's not a reason to have any earlier intervention. So that is absolutely not true.
So reduced hospital stay does not in any way equate more intervention or rushed labor.
Right, so shorter hospital stay has to do with what happens after you have the baby, right? So if you have a baby, by C-section, we used to send you home post-op day 3 or sometimes day 4. Now everyone's going home post-operative day 2. And if you have a vaginal delivery, most patients used to go home postpartum day 2. Now they're gonna go home day 1. So the shorter hospital stay refers to the postpartum care. It doesn't refer to what's happening intrapartum.
Great. Are inductions more likely to happen? I know we're really driving this point home, but
COVID is not a reason for induction of labor. Now, if a mother is sick or is deteriorating, or there's something else that's really going on where she needs intensive care, that's a different story. But we haven't had any, we haven't had that happen, and I hope that we don't have that happen.
how long will I be able to stay in the hospital after delivery?
So just what I said. So 24 hours postpartum and 48 hours after a C-section.
If my baby is breached, do I still have the option to go through the ECD?
Yes, absolutely. That has not changed at all.
Is a pregnant patient allowed to ask for an induction? If so, what are the benefits or downsides?
So can you ask for an induction because of COVID? That's not an obstetrical indication for induction of labor. All of the standard obstetrical reasons for induction of labor stand. So if you're worried about COVID and you want to be induced, I mean, I think that's a conversation you have to have in terms of there are other things going on that require an induction, but COVID in and of itself is not a reason to induce labor.
During my first labor a couple of years ago, there was overcrowding on the labor and delivery floor after I delivered with moms on stretchers in the hall. Is this still a problem that occurs at NYU? If so, how has COVID changed this practice? I know we've answered this, but we do want to touch on it again because it came up a lot.
So yes, has that been a problem in the past? Yes. Can I predict that it will never be a problem going forward? You know, obviously not. But what I can say is that there has been a little bit of a dip in the number of deliveries happening because people have moved outside the city. So that means, I think that means that we will have less people laboring in triage, laboring in the hallways or in ORs. So if anything, I think that will work to your benefit if you're having your baby at NYU.
Has NYU lessened its no filming policy?
No, you still cannot film there. COVID has not changed that at all.
Are circumcisions still happening as planned?
They are, Gulzar, they are.
Do you have any suggestions for childcare for existing children while in labor during this time? Should my partner just stay home?
Yeah, this is such a tough question. I don't know. This is the one that I struggle with the most. Do I want to have a pregnant patient not have their partner with them? No, that sounds, you know, I don't know, not the right thing to do. Should you limit the number of people that you guys are exposed to? Yes, I think you have to kind of, each family is different. If you have a nanny or there's someone in your home that's kind of part of your circle, and they can stay with your baby, that would be ideal. Do I feel strongly that you need your partner to miss your labor and stay with your baby? I don't think that's the right decision either. So the question will come up, does someone come from the outside and come into your home? And I don't know that that's something that I can make the decision for our patients. I think, you know, they should limit exposure as much as they can, but you got to do what you got to do. And I don't think having a partner miss a baby's birth is necessarily the answer to that.
We're going to move into postpartum, and we'll kind of come back to this question about having somebody else come into the home, and we will address it a little further in depth in a few minutes. So first, given that we need to leave after 24 hours with a vaginal delivery, is there anything in particular that we should have at home?
Yeah, the only thing that I think you should have is your breastfeeding essentials. Thank you, Perry. You're going to need, like, if you're using a nipple ointment, your bras, your breastfeeding pillow, you need all that stuff. And then the other thing is, like, the underwear that we use. We wear like these very meshy underwear that we give everybody. So, and I've never seen them sold in the store, but anyway, you want to get some kind of,
I think some variation of them are available on Amazon though.
Oh, really? But you want, and I was telling Gozar yesterday, like granny panties, like you want the underwear that like come all the way up over your belly. If you had a C-section, you definitely don't want that band sticking right in your incision. So something that goes all the way up, and your super duper maxi pads with wings or whatever you can find, overnight protection. You need some heavy duty maxi pads. So those are the things I would stock up on. Motrin and Tylenol.
It just doesn't sound very glamorous.
Postpartum isn't that glamorous, Gulzar. You know that.
I've seen some delivery group posts that NYU is not giving materials for women to take with them, underwear, maxi pads, etc. Could you go over what we need in the event that there are not sufficient supplies to take with us?
Yeah, just what I said.
But is that true? Can you answer that comment about that?
I have not seen that. I haven't had a patient, I just rounded this week, I haven't had a patient say that, actually, now that I think about it, they were all wearing those underwear. So I don't think that there's a shortage of them. I answered the question.
Are you advising new parents and babies to quarantine from family for 14 days after birth?
I mean, I think the social distancing rules still apply. So do I think you should be quarantined? I don't think that's the right word. I think social distancing is more of the right terminology. Do I think you should have like grandparents and nieces and everyone coming to the house? I really don't. I think this is the time that you should rely on your Zoom or your FaceTime or whatever it is that you use. But I wouldn't be having tons of people come to the house, or anyone if you can avoid it.
Should we cancel our baby nurse?
Weren't you going to answer this one, Gulzar? So I guess in that, keeping with that kind of idea of having social distancing, if you can avoid having someone come into your house that isn't absolutely necessary, then I think that would be ideal. I'll let you take it from there, Gulzar.
I think it's really important to think about what works for you and your family. There is an emphasis on social distancing, but if this is something that you think you really need, and you trust your baby nurse and your baby nurse is isolating for the 2 weeks before, and you feel like not having your baby nurse is going to increase the potential of postpartum depression or cause too many issues, or you'll feel too overwhelmed and isolated, then I think that's a decision you have to make of your own. Obviously, your medical professional is going to say limit exposure, limit exposure, limit exposure, but you should also think about all the different variables. If you can't do it without your baby nurse, then that's a different decision that you need to think through and talk to your partner about. But, you know, I do think it's really important to make sure that you have the right amount of support postpartum and that you are as long as you are doing all the things necessary to limit your exposure and try to make sure that everyone is being safe and isolating before getting together, if that's a risk you're willing to take, that is your own decision. And you should feel entitled to making it whatever works for you and your family. Next question is, how can I be sure that I'm receiving proper postpartum care in these uncertain and isolating times?
So they have you, first of all. So without COVID being around, it's a very sharp change because we're seeing patients every week. You give birth and then we don't see you for 6 weeks. But that has been true even before we were in this pandemic, right? So postpartum care is delivered at 6 weeks, regardless of if there's COVID or no COVID. I think the nice thing that we have is that we have you and Perry, who kind of check in with everyone's emotional well-being as well. And I think that's something that other practices don't have. So there's nothing that's really changed in terms of COVID in the consistency of care.
Yeah, and I think postpartum, this is a really difficult time in that you don't get to have as much support or help. Now, people can drop off food, people can bring you supplies, but you are a lot more isolated with your partner. Hopefully, if you have a partner, your partner is taking time off and is able to really support you at this time. Now, at any point, you are welcome to reach out to me or Perry. I'm working with patients individually. I'm running groups. Perry is doing a ton of phone support. And we can talk to you about how to set up your scenario so that your partner is helping. But I do want to address the partners who are listening. It is so important that, especially right now, you step up. I get that everybody's jobs have either gotten really easy or have gotten really hard. But this is a really important time that you step up and be there for your partner. And that means it is her who is feeding the baby, that means it is you who is feeding her. If she's making sure the baby is fed constantly, you are making sure she is fed constantly. It's so important that she keeps her blood sugar stabilized and that she's not forgetting to eat, both for the breastfeeding and the extra calories she needs for breastfeeding. And even if she's not breastfeeding, just for the recovery and for herself to be able to manage. So that means that you are making sure she has her 3 meals a day. That means that when she is breastfeeding, you are bringing her water and you are bringing her snacks to make sure she eats. When women start breastfeeding, they don't think about themselves before they sit down to breastfeed. They have a crying baby and they go and they breastfeed. And it's too late to get up and get themselves a snack or get themselves some water. And so it is the partner's responsibility at that point to make sure that she is getting what she needs so that she can take care of the baby. That being said, I've always been a big fan of night nurses for those who can afford it because they are an incredible luxury. But now is the time for partners to really step up and play night nurse, really take over that role of night nurse. Just because she is feeding the baby doesn't mean she's the only one who wakes up and does everything. What I often recommend is that the partner gets up and goes and gets the baby, brings the baby to her so that she can stay in bed as long as possible without moving. And she can feed right there in bed. The less she moves, the less she is waking up her body. And the easier it is for her to fall back into REM sleep. So it's really important that the partner gets up and gets the baby, brings the baby to her, she feeds the baby, and then the partner takes the baby away and does whatever it takes to get the baby back down, change, burp, soothe, whatever needs to happen. Now, I get that most of you are going to have a bassinet right next to your bed and you can just reach over and get it. I don't even want you moving that much. I want at least half of the night or at least several nights a week, your partner to be doing all of that so that you can really get some rest. You want to get 2 full REM cycles. So 2 full 3-hour sets where you are doing as minimal as possible and trying to kind of fall back asleep while your partner makes sure that the baby is feeding. If this doesn't make sense to you, the way I am explaining it now, I want all of the women on this call and all of the partners to know you can contact me and I can explain this to you better, and so can Perry. But this is really a time for partners to step up and help postpartum so that the mom does not feel isolated, so that we can prevent any postpartum mood disorders. I do want to say one more thing. It's really important that the mom is doing some things for herself alone that has nothing to do with the baby to reconnect to her prior sense of self. That doesn't get to mean going out anymore, but it does get to mean maybe having a Zoom call with a friend who's fun and reading a book. It's not just taking a nap, and it's not just getting therapy. It really is something that reminds her of her old self before the baby. And so we should all the partners should be making sure that their wives or significant others are getting that time. The last question is, how can I connect with other moms with similar due dates? I plan to do this prior to quarantine, but I'm sure about how to go about it now.
I wanted to tell a funny story.
Oh, go ahead, please. We'll come back to that question.
I was postpartum. My best friend, who is a pediatrician, she would come over and be like, we have to go to Target. And I'm like, okay. And we would leave, and I would be like, okay. And we would leave, and we would go to like a bar restaurant. She wouldn't even tell me. We would sit there and like eat burgers and fries and just like chit chat. But I have to say, like, it was so therapeutic. So therapeutic. She just like came and kidnapped me, and we like just did our own thing for like an hour. And it just meant the world to me, and it just makes you feel so much better.
Yeah, it's really important for the mental health of the mother to be able to have some time to do something for herself and get away from that. And that rejuvenates her so that she can go back to her baby and be in a better place. And that's better for the baby.
Yeah.
So connecting with other moms of similar due dates, I have been running pregnancy and postpartum groups. I currently have 4 running. If there is enough demand for more, I will put more together. So reach out to me. If I don't have one to put you in, then I will help make sure that you get into one somewhere else. But we are running so many groups at Downtown Women that there's no reason why you can't meet other women with similar due dates. And so far the groups have been a success, and it seems like we're really just going to keep them going. So by all means, reach out, and Perry or I can put you in a group. And then before we get to the Q&A, one general question. I know none of us has a crystal ball, but any idea when things may return to normal?
You know, I don't know. I mean, I think just from watching the news, it sounds like it's going to come around in stages, and seeing if we like pass stage 1, if we can move on to stage 2, and if we pass stage 2, if we can move on. I think the thinking at Downtown Women is that we're going to open our office around June 1st. It's definitely not going to be May 1st. So I think we're hoping that at that point, there'll be something that looks normal at that point around June 1st, at least from our office perspective.
Great. And then we do want to point out that we did get an update from one of the other doctors, that all patients and partners are having their temperatures taken prior to coming into the unit. So they are screening asymptomatic patients?
No, when I was at the hospital, I think that may have been something that was just updated recently, but I wouldn't be surprised if that, was the case.
So you might have to anticipate that. Things are changing so rapidly, and we're going to keep updating everyone as this happens, but we'll see.
We'll see. We'll do another webinar.
Yes, I'm sure we will. Okay, so now we're going to go to the Q&A. I know this is the moment you all have been waiting for. If I'm out of town for my 28-week visit, can I get the test needed elsewhere but remain a Downtown Women patient?
Yes, of course. So just a word about that. At that visit, you actually need a special drink called a glucola. So we have not been providing them for patients unless we see them very early in the pregnancy. So just know that that's an hour-long visit. Once you drink the glucola, it takes an hour for us to draw your blood to get an accurate reading.
Great. I am worried that with telehealth visits, I will have less chances of meeting all the doctors that could potentially deliver my baby. Can you comment on this?
Yeah, that's a possibility. I mean, hopefully we'll be doing more webinars. I mean, part of why we wanted to do this, and we want to start rotating practitioners. I don't know, somehow I always get blessed to be the one that gets to do it. We're going to start having other practitioners do the webinars. When you come to the office, the other thing that we can do, and we've done this before when patients get to term and they haven't met one of us, is we'll just pull one of the doctors in to meet you so that you can meet Dr. So-and-so in case you haven't met them before. But honestly, like, that's a valid concern. You know, we'll try to get everyone to meet everyone, and hopefully via webinar too, you can feel more familiar with some of the physicians.
Great. And so if you look in the answered questions in the Q&A, I have put the link to the feedback form. These kinds of things are really helpful. If you are telling us that, if your feedback is that you want to be able to meet the doctors in a variety of different ways, then we are going to integrate that. And so let us know, really please fill out the feedback form so that we can address these things in different ways. We're looking at other ways to incorporate more doctors in these webinars so that you can have at least some FaceTime and ability to communicate with them. But really, please fill out the feedback form so that we can address this in a variety of ways. If the hospital determines that mother and baby should be separated because the mother is positive, are you worried about them being together immediately upon discharge?
Am I worried? Am I concerned? Yes, of course. I mean, again, we don't think that this is, generally speaking, a disease that affects newborns and children. I think that if you test positive for COVID and your partner is asymptomatic and not positive for COVID, assuming that the partner should, you know, be doing as much of the caretaking as possible, and you would kind of continue kind of what the hospital is doing, which is, you know, having you pump breast milk or hand express and then giving it to the baby until you're feeling better. Ideally, that would be what would happen.
So keep it nice. So also, what about the masks? What are you thinking about the masks?
I think masks are a good idea. Can you still see me, Golzar?
I can still see you, yes.
I did something.
We can tell that you're doing something else.
I'm gonna stay like this.
Okay.
Leave it to me to mess something up.
See, this is why you keep doing them with me. We have chemistry. Okay. If a partner cannot come in for the 32-week ultrasound, can we do a video phone call with my partner?
You can't record it, but we've been FaceTiming almost every visit with partners. Every time I have a visit, we FaceTime, and that's totally fine.
Okay, so that's great to know. Yes, FaceTime during the visits. Are laboring people currently being made to wear masks during labor and or delivery, and can they walk around at all?
Can you walk around the unit? No. Can you walk around in your room? Yes. If you come in and you are in early labor and you're discharged, you know, that's, you know, you can walk around. I mean, we'll try to, I have not seen anyone walking around in the hallways, and I'm sure that the reason is to prevent COVID spread. So not in the hallways, but in your room, yes.
Great. Any suggestions for how to handle reintroducing siblings to the home after mom and baby come home? Should we isolate as much as possible for 2 weeks since we spent time at the hospital?
No. I mean, there's so much going on to protect everyone, to protect our patients from getting COVID. And that just sounds mean and cruel. And no, I don't think that that's necessary at all.
Yeah, that sounds like it would be really hard on the siblings and on the whole family. It's a good time to be together. Agreed. I mean, if you think you have symptoms or you feel like it's the right thing to do, listen to that, listen to your gut, but really, this is such an important time for the family to be together.
Agreed.
I already had my 32-week appointment as a telemed visit as instructed by Downtown Women. Do I need to make another appointment to come in to check the position of my baby, or will that be done at my 36-week appointment?
Well, if you came in for your 32-week appointment, it was a telephone visit? Is that what she said?
Yes.
Yeah, then we'll check at 36 weeks.
Great. Should you eat breakfast before coming to the office for the diabetes test?
Yes, you should, or lunch, whatever meal is appropriate. Good question.
When I came in for my 28-week visit, oh, sorry, I don't know. Oh, there it is. When I came in for my 28-week visit, they didn't give me the Tdap shot. I have done my 32-week visit already at NYU. Do I get it at 36 weeks then? Usually
The 32, okay, so that sounds a little bit off. So usually we give it between 28 and 32 weeks. So they said the 32-week visit was at NYU?
Yeah.
Okay, that sounds off. I would contact the office so that for that particular patient, contact the office. 36 weeks is a little bit late to give a Tdap shot, so I feel like you should contact me. And I don't know who you are, but just remind me that it's you, and I'll figure it out for you on Monday.
I will write down your name, and I will give it to Dr. Lajoie, and somebody will reach out to you to discuss that with you.
Yeah, sorry about that. That sounds like something's off a little bit.
Would you anticipate the hospital changing doula rules anytime soon, like September? A lot of people are very curious if they should hire doula.
I can only hope. September's a long way away. I don't know. Like, is it worth hiring a doula now with the anticipation that in September things will be back to normal? I don't know. I mean, some people are predicting we're going to have another wave of this in the fall. I don't know the answer to that.
But I guess if you feel like the most important part of a doula is having them in the hospital with you, you might want to err on the side of caution and not hire one. The reality is they'll probably be available a lot more easily than they used to be.
Right. And if you feel like a doula is really to keep you home, then it might be worth having a doula so that she can do some virtual work with you at home. I think it depends on what you want to get out of a doula. If you feel like you really want her to be home with you, it's easy enough to Zoom her or FaceTime her in so that she can kind of, guide you through that part of your labor. So I agree. It's a little bit of a toss up right now.
They might also be doing more prenatal, like
postpartum stuff.
Prenatal and postpartum stuff. So you might get more or different things out of them. So definitely talk to them. But if it's critical to you that they're in the hospital, you might want to err on the side of caution. Deb, our CFO, said that we rock. So I just want to acknowledge that and say thank you for your wonderful comment.
I can't see myself now, so this is difficult.
I'm confused about which weeks we'll have telehealth visit, which weeks will those happen, and how does insurance coverage work? Will we be billed as if it was a normal checkup? So look on your screen, and we have the visits on your screen again, so you could take a picture. But can we talk about insurance coverage for this?
Yeah, insurance coverage for telehealth is the same. The insurance companies don't see that it's different, but the truth of the matter is with prenatal care, it's a global fee. Like there's one fee that covers everything. That's, my understanding that it covers all of the antepartum care, intrapartum care, and postpartum care. So I don't think there will be any extra charge or anything like that for telemedicine.
Great. Somebody asked, why are the telemedicine visits telemedicine versus in office?
Because we're trying to limit COVID exposure.
Perry, can you cycle through some of those other screens that we were showing earlier, just so anybody who missed it could get them now? Can partners attend the first 10-week appointment?
Partners cannot come to any appointment, but you can FaceTime them.
To clarify, I understand the dangers of going in and traveling in these unprecedented times. It's just that my first pregnancy, I'm 40, and frankly, I'm worried that to telemedicine just isn't the same quality as in-person visits.
Okay. I mean, we have been making exceptions. If you really feel like you want to come to the office and you need some reassurance and have us listening to the baby, then we have been making a few exceptions. We really want to limit patient exposure. Obviously, when you come to our office, it's not that it's small, but the waiting room is, not that big. And we want to really reduce the amount of exposure to our patients and to ourselves, because we have to stay healthy for everybody. But if you're really feeling like you need to hear your baby, then we'll absolutely, we'll have you come in and make an exception.
Great. I do want to say that Downtown Women has always been really accommodating with patients and understands that if you need something, we will talk to you about it. So do reach out to us. So somebody just sent me a picture of a face shield that has been given to babies in Thailand. It's one of those.
Yeah.
Is that happening? Are babies given
for babies? No.
I guess if you want to buy one, you're welcome to buy one for your baby, but we are not doing that anywhere in the States as far as I know.
I've never even seen that.
I'll send it to you after, don't worry. Have you seen doula support show up virtually during how have you seen doula support show up virtually during labor at NYU? So can you talk a little bit about your thoughts and what you see in terms of virtual doula support?
So I think what this patient is asking me is, can you have virtual doula support when you're in the hospital? Like, can you Zoom them? Absolutely. I don't see why not. I think my understanding is the virtual work is mostly in the home of the patient in the early stages of labor. But I don't see any reason why you can't Zoom or FaceTime with your doula while you're laboring in the hospital.
Can you share these slides after the webinar? Yeah, so you can either email me, just email me and I'll send them to you. That's fine. Email me or Perry and we'll send them to you. We don't mind. So by all means. Is the bathroom shared? Actually, email Perry and she'll send them to you because she has them on her computer. Is the bathroom shared in the postpartum room?
Yes, but it's very well maintained and cleaned. But yes, it is a shared bathroom.
How much are the private rooms and how many private rooms are there?
I don't know. How many private rooms are there? I want to say on 13 East, I want to say there are 4. But understand that the way they fill the room is they'll put one, even if it's a double room, they'll put one person in each room before they double people up. Does that make sense? So even if it's a double room, they'll put one person in there and then they'll put one person in the next double room and one person in the next double room. So essentially, even though the room is made for 2 people, we try to keep you, one person per room. So it's hard to say. And I have no idea how much the private rooms are. I'm sorry. I'm sure NYU would let you know though.
So they try to give people their own rooms as much as possible. So if not a lot of people are delivering, you might default on a private room anyway.
We only double if it's absolutely necessary.
Great. Can you opt to get a private room day of, or does it have to be pre-planned?
There's no pre-planning to get a private room. It goes by time of delivery.
So you just show up and say, I want a private room?
Right. You don't even say it until after you give birth. As soon as you give birth, they'll say, you don't have to say it or remember to say it right away. When you give birth, it's always the mom that's like, don't forget the private room. And then you can ask, it's no big deal if you forget, and it goes by time of birth anyway. So don't worry about it. You just have to ask.
Great. How long until patients are discharged? Are moms supposed to wear masks during the entire birth process? Are they working toward testing everyone, including those who are asymptomatic? So we've covered these a little, but let's give a short answer for each one since this attendee might have missed the beginning.
Yeah. So I think the more you can wear your masks, the better. I think it helps to protect us. And what was the other part of that question, Gulzar?
How long until they discharge? Are they supposed to wear masks?
So we talked about the discharge now, that it's 24 hours postpartum, 48 hours after a C-section, and does not affect the interpartum care. There's nothing being rushed in terms of interventions. And bring a mask and wear it as much as you can. I mean, we're not forcing people in the second stage of labor to wear their masks, but if you can wear it as much as you can, it's appreciated.
And they are not testing people who are asymptomatic, but they might be screening people.
Right. They might be screening people with checking temperatures, which is what we just heard from Emery.
Somebody wants to know, when we say private rooms, are those for birthing, postpartum, or both?
So the birthing rooms are private. The postpartum rooms are the ones where sometimes you'll have a roommate.
Instead of a car seat, how about a stroller instead?
If you're walking home?
Yes.
Most infants don't, babies that are that small usually don't go into strollers as far as I know. Usually it's a car seat that kind of clicks into something else. But then again, my baby is 8, so something might have changed. I think if you're walking home and you don't need a car seat. That's my understanding.
I have heard from somebody who was walking home that they were not discharged until they had a car seat.
Oh, really? Okay, so I stand corrected.
If you have a stroller, one of those strollers that's a car seat double, that's ideal. That'll be fine. But you might want to contact NYU because I have heard mixed things about that.
And I can find out if we're going to do another webinar, Gulzar, either with me or with somebody else. I can clarify that with one of the postpartum nurses.
Okay, so we will address this in the following webinar.
I know they do have like a car seat safety thing at NYU where you bring your car seat and they show you like how to strap it in and how to, you know, do all those things. So there is some information in the hospital in terms of getting your car seat ready for the baby.
Which participants are required, which patients are required to stay for 48 hours and which are released after 24? And is it, go ahead.
So it depends on if you give birth vaginally or from a C-section. And this is assuming that there's no complications, everything was smooth, everything was ideal. With a vaginal delivery, 24 hours or so, and with a C-section, 48 hours or so, somewhere around there.
And is a patient with gestational diabetes allowed to leave after 24?
With a vaginal uncomplicated delivery, yes.
Okay. And just to be clear, you need to bring your car seat. You cannot leave your car seat in the car. You need to bring it to the hospital. Yeah. You need to bring it in with you. So please bring your car seat with you. Are we confined to our laboring room as a patient, or can we walk the halls?
I haven't seen any patient walking the hallways since this started.
Is there ever a situation where there aren't enough labor and delivery rooms?
Has that situation happened? Yes, and we make do. So we have triage beds, we have recovery room areas, ORs, we have lots of places where we can put laboring people for their birth. The nurses are great. They just bend over backwards to accommodate patients, and we always work it out. We always work it out. There will be somewhere for you to give birth, and it will most likely be a labor and delivery room, which is private. It will be private regardless of where you give birth.
Can my partner leave after the birth, go home, and come back a day later, or does he have to stay the entire time? If he doesn't stay, will he just be informed of how to pick me up after?
So he has to stay. He cannot leave and come back. Can he meet you downstairs or come into the lobby? I'm sure that's totally fine.
But he can't come back up to labor and delivery and like escort you down.
For the postpartum, no. Once you're in, you're in. Once you leave, that's that.
If someone is showing symptoms at the hospital and does a swab test, are they automatically treated as COVID positive? I've heard it can take a while to get test results back.
If you're a person that we're suspicious that you have it, then we will treat you as such. I'm not sure about the turnaround time with the COVID test, but I'm sure if it came back negative, then whatever, you know, distancing was made between you and the baby would be, you guys would be together right away.
We can also look more into this and address it at the next webinar. Perry, can you write that down for us? Would you consider doing Zoom calls for televisits so that we can meet the doctors better?
Yes, I got trained yesterday to do televisits. Yay! It was a little bit of a challenge, you know, because I'm not great with my technical stuff, but yeah. So that's another tool that we actually just started, and probably this week coming, I'm going to start doing televisits. We're all getting trained to do it. So that will be another way that you can meet us. And we really want to meet you guys too. I just have to put that out there. We really want to meet everyone. So this kind of goes both ways, but we really want to meet you guys too. And we look forward to kind of getting to know you.
And again, like really let us know, give us lots of feedback, because I'm open to coming up with lots of ways to make sure that everyone is getting at least some exposure to all of the doctors. Okay, we are going to take a few more questions, but don't worry, we are going to do another webinar, so you can always send us more questions for the next webinar. I am both a longtime patient and the author of the article you just read from. I just want to point out that NYU's policy allows the mom to refuse separation if she chooses. Would Downtown Women support that decision? Thank you for...
Wow, what a coincidence those are, right? Yes, we would support that. Of course, we would support whatever decisions you guys make. If you feel strongly that you don't want to be separated from your baby, then of course we would support that.
Great, thank you for reaching out. I'm glad you're here with us today. Okay, so somebody just asked, when does calling an ambulance become an emergency? I do just want to say that when you go into labor and you call the emergency line and you are talking to the doctors, that is a time that will be when that decision happens, right? This is not something that we're going to give you answers.
We'll determine if it's an emergency and you have to take an ambulance. But I have to say that is super duper duper rare. But if you think you're having an emergency, call one of us and we'll help you figure it out. We'll figure it out together.
Okay. Do you, after discharge, do you well, we answered this. I just want to, the blood pressure cuff I bought says that it is contraindicated for pregnant women. I imagine just because it hasn't been tested on pregnant women, can I use it anyway? Brand is Balance.
Yes, you should use it. It isn't contraindicated in pregnant women.
Great. It's probably just a liability issue. Can my partner come and go from the hospital after delivery but before discharge? Yes, they can come before the delivery. Oh, after the delivery.
Wait, can they leave after
the miss the delivery but show up postpartum and then leave again before discharge? So can they just stop in if they only come once and they're the only person who comes?
Yeah, absolutely.
Then they show up.
Yes. If they're just coming in once and leaving once, it's totally fine. I hear the sirens in your house.
I'm so sorry. Okay, so do you want to take one more?
Sure.
I think this is a really good one. Is there Wi-Fi at the office for patients to be able to get on FaceTime with their partners?
Yes.
We do have Wi-Fi, so we are accommodating your partners being FaceTimed in.
And don't be afraid to ask the person you're seeing. I mean, I want to say almost every visit that I've done in the office, not all, well, maybe not, whatever. We're really open to FaceTiming with your partner. We want to include them as much as possible.
And do you know if there is Wi-Fi at NYU so that people can FaceTime doulas or family during labor?
Yes, there is Wi-Fi at NYU.
Okay, I think that's really good to know. And they can actually Zoom and FaceTime with the doula during the delivery?
Yes, that's fine.
Okay, and the last thing we're going to answer, and then we're going to have to wrap up. I'm so sorry, but we are going to do another one of these in 2 weeks, is should I buy a baby Doppler monitor? We did not address this time. We addressed it last time, but that is a very strong answer. Go ahead, Dr. Lachois.
No, don't buy a baby Doppler. You don't need one. We know how to use them. We know how to monitor your baby. We feel really comfortable with the protocol that we've set up, including televisits. And I feel like it can cause a lot of panic if you're not able to feel if you're not able to hear the fetal heart rate. So I don't recommend getting a fetal Doppler for your home.
It will increase anxiety, and all the patients who I've worked with who have had it have had a horrible experience with it, being terrified and like overusing it and freaking themselves out. We do not recommend it. Okay, so for all the questions that we did not get to, we are very sorry, but we are so happy you joined us. We are going to do this again in a couple weeks. We're going to hopefully bring another doctor so that you guys can get some exposure to somebody else. Continue to send us your questions. Please look on the chat. The chat should be available to you now, and fill out the feedback form. It's at the very top. There's a link. You're going to get it in your email tomorrow. And I have also put it in the Q&A under the some answered questions. So, but reach out to me or Perry at any time for questions, comments, concerns. If you want to join a group, if you need some support, if you need a referral, and hopefully we will see you again in 2 weeks. Thank you so much for joining us.
Thank you for watching, guys.
All right. Bye.